Hi, I'm Sam Oussedik. I'm a knee surgeon working in London, and I'd love to take you through today what can happen to your anterior cruciate ligament, or ACL. So many of us have heard of ACL injuries because sportsmen commonly injure this ligament. It's found in the center of the knee and runs from the front of the shin bone through to the back of the thigh bone, right through the middle of the joint, between the two knuckles of the thigh bone. Now, by crossing the joint both from front to back, but also a little from side to side, the ACL's primary purpose is to stop the shin bone from slipping out or rotating out from underneath the thigh bone. The thigh bone is one of the longest bones in the body, and the shin bone is the other longest bone in the body. And the length of those levers means that you get enormous forces or torque generated at the joint. And so the knee is very dependent on both those static structures of ligaments, but also the muscles around it in order to provide stability. The ACL's main purpose then is to stop the shin bone from rotating out from underneath the thigh bone. If it does rotate too far, then the knee is liable to give way. Also, if that happens, you can get damage to some of the other structures in the joint, such as the articular cartilage or the menisci. The menisci are the little pads of cartilage that sit between the thigh bone and the shin bone and offer a little bit of cushioning, but also support and stability. So, how are ACLs injured? Well, we've probably all seen videos of sportsmen injuring their ACLs during matches, perhaps during training. And typically what happens is that the foot is planted and then the person rotates in the other direction. So if you rotate away, then your shin bone will rotate inwards against the thigh bone, and going too far in an uncontrolled manner will mean that it shears off, usually from the thigh bone side of the attachment. If the ACL does get torn in that way, you'll know because you often feel a pop as the shin bone comes and strikes against the thigh bone in a position it shouldn't be in, and it'll become painful. Now, the amount of pain and swelling generated varies from person to person and is often dependent on the amount of energy that's gone into the injury. So I've seen patients certainly who've had nasty ski injuries and there are lots of tissue damage, lots of swelling, lots of pain. But equally, I've seen patients who've simply landed awkwardly and a little false movement has led to the ACL tearing in isolation. Not very much pain, not very much swelling. So that initial presentation, the way it feels to you once you've injured yourself, can vary a great deal. Now, the second problem with the ACL is that it tends not to heal. So although it's commonly injured, it doesn't tend to heal very well by itself, meaning that it often needs some form of treatment in order to restore that rotational stability. As previously explained, the knee relies not only on ligaments but also on muscles to regain stability and to provide stability, particularly through rotation. So for some patients who are not particularly unstable, don't really rely on pivoting movements for either their recreational or professional activities, it may be appropriate to simply have physiotherapy exercises prescribed in order to restore enough stability to the knee to allow it to function well. However, for other people who rely on their knees in more rotationally demanding events, such as playing sports to a high level or even walking over an uneven ground on a frequent basis, having an ACL is really quite an important part of allowing the knee to feel stable through those activities and reducing the risk of it giving way, causing further damage. And in such cases, an ACL reconstruction can be discussed as a possible surgical solution to what would otherwise be a difficult problem. I'd be happy to take you through all of those, and don't forget that not only do we need to get imaging to diagnose this, but talk to you, find out exactly what your needs are, and very importantly, examine you and your knee to figure out how much laxity has been generated by the injury. Once we've got all of those things together, finding out the best way to treat your injury is really what it's all about on an individualized basis. I'd be very happy to take you through it.